Hello friends, it's pleasure to have you back on the channel of Clinical Care Insight. Today we are going to start the first lecture series of class 11th and 12th biology. So here is the class 12th biology reproductive system unit, okay, and the name of the chapter is reproductive health. Fine. So first we will understand its academic value, then we will go ahead and we will also discuss that apart from giving the academic marks, what these chapters give us as a for the life suggestions, okay, for the life advice, what we get from this chapter. So if we're talking about the academic the value, then in the board exam 1 to 2 question is generally asked from this chapter called reproductive health. Fine. And in the NEET there are two questions, okay. 2 is sure, but sometimes it's 3 or 4, okay. So 2 or 3 questions is surely asked each and every year in the exam of the NEET, okay. And you can answer these questions if you have the good control on NCERT biology specifically, okay. You can easily correct those questions and get the marks, okay. So let's start to discussing about this reproductive health, okay. So as you are seeing the lecture outline, today's our lecture outline is first we have to discuss about the reproductive health, okay. What is reproductive health? First we have to define it, okay. Then we will understand that what problems it have, okay, and what are the strategies to overcome those problems. Fine. Then we will also discuss that due to the advancement in every field including medical field, we by using the drugs, okay, we can easily encounter the microbes, okay. We can easily deal with the deadly diseases which previously we are unable to fight it. Fine. So that's why the longevity is enhanced, is increased now, okay. So due to this and lack of the how to plan for a family, fine. So lack of this knowledge also give impact on the overall populations, and we have the explosive the population. Fine. So we will discuss about the population explosion and birth control, okay. You know that you have the limited shelter, okay, you have the limited food, okay, you have the limited water, fine, and also the place. So government has to take certain steps. So those all steps, okay, is primarily a birth control, okay, how to control the birth rate. Fine. So we will also discuss about the birth control. Then we will discuss about the medical termination of pregnancy, okay, called as the abortion. Then we will discuss about the most interesting, okay, and the challenging topic called as the sexual transmitted disease, STDs, under this chapter, okay. And at last we will also discuss about the infertility, okay, unable to have the baby, okay, how to cure it, what are the underlying cause, fine, and what are the alternative ways, okay, to make the infertile couple have a children. Fine. So this is the overall lecture outline. Now let's start with understanding the reproductive health. So we know that generally we define health as a physical, okay, behavioral, fine, as well as the mental, okay. If all these three aspects are balanced, fine, we considered a man as a healthy. In the same way, the reproductive health by the WHO is defined as that it is a total well-being in physical, emotional, social and behavioral aspect in the reproduction, okay, related to the reproduction. Fine. And you have to also understand, keep in your mind that the physical fitness and reproductive fitness is a two different thing, okay. It's not a synonymous. Fine. It might possible that one person who is physically fit but they have certain the reproductive problem, okay. So the physical health and the reproductive health both are not correlated, okay. It's not correlated. It's not necessary that if a person is physically fit, then it must also be the reproductively fit. Fine, no problem. Now let's discuss about the reproductive the problem and strategies. So what are the reproductive problems? You can comment down what are the reproductive problem. You know that one thing, you know that overpopulation. If a family, okay, a couple have lack of knowledge, okay, thereby they don't know how to control the birth. Fine. And what are the ways, what are the methods by which we can control the birth? So overpopulation is one of the the challenging thing, okay, as far as the reproductive health is concerned. Then we have the early marriage. In the early marriage, generally these early marriages are found where I was, my state is, that's the Bihar. Okay, so basically if you're talking about my state Bihar here, generally in a, you can say that those people who are under the poverty line, okay, they marry their daughter, okay, or sister sooner, fine. And that's not correct actually, because there is we know that a female can you can say attain the menstrual cycle which is required for the giving the birth, fine, which is required to conceive a baby, fine. So it start after 15 or 16 year, okay. But also this year is not, you can say, marriageable age. Why? Just because in this age the hormonal level is not, you can say, that much significant that they can hold a baby, okay. So it lead to the various, you can say, problems, complications. One of the complication is female, those who bearing the baby in their 16 or 17 or 15 or 14, they have the anemia, okay, and sometimes they not give the live birth, okay. The baby which is delivered is a dead, fine. So and also the deformities, okay, these all are the these all are very you can say common in the early marriage, okay. And that's really challenging for reproductive health. Then we have the health of mother, okay. So we know that maintaining the reproductive health, we also need to take care of the persons, okay, take care of the person, you can say, reproductive need, fine. And you know that reproductive need is also depends upon the nutrition, okay, also depends upon the nutrition. So sometimes lack of nutrition, okay, lack of hygiene, it can lead it can cause a problems, okay. So that's a challenging for the mother, fine. Then the deformities, as I said that in the early marriage the deformities are common. Deformities means baby born with one hand, okay, and sometimes the hand is, you can say, twisted, okay. Sometimes the neck region is more thick, fine. Sometimes the ear is intact, okay, is impact basically, okay. Sometimes cleft lip. These are the common things, okay. These are the common things associated with the early marriage, okay. So these are the deformities. Now then we have the maternal mortality rate and infant mortality rate. See, due to the advancement, as I said, due to the advancement in the medicines, we have you can say advanced ways to tackle with the diseases, okay, to manage the diseases, fine. So that's why the maternal mortality rate is high nowadays, as well as the infant mortality rate, because we have the lots of vaccines which are, you can say, given to the, you can say, newly birth newborns, fine. And thereby we can prevent the many diseases. If you take the example, you can take the example of the polio, the tuberculosis, fine, cholera, and many more, fine. So that's why the maternal mortality rate, okay, and the infant mortality rate is, you can say, very low, okay. It's very low basically. Then we have the sexual transmitted diseases. The sexual transmitted diseases are really very challenging as far as you can say the maintaining of reproductive health is concerned. How? See, these diseases not only damage patient reproductively, or you can say the physically, it can also harm a patient mentally, fine. It's also you can say disturb a patient mentally, fine. So this sexual transmitted disease, we have the detailed lecture over it in our upcoming lectures, but for a while you just understand it. Sexual transmitted diseases are those diseases, okay, which occurs due to the improper, you can say, sexual contact, okay, or you can say it is basically transferred from the person having the sexual transmitted disease to the person who have not the sexual transmitted disease. So basically the contact transmission is there in the case of sexual transmitted diseases, fine. And there are certain diseases, you know, the most discussed disease in the era called as the HIV or AIDS, okay, and that is also a sexually transmitted disease. And we have the many more, we have the detailed lecture, fine. And the career, you know that early marriage can block the career of a female or a girl who is married in a early, you can say, their age, because early age is meant for you can say the educations, getting their skills, fine. But in that age, if a girl got married or boy got married, that they can block their career, okay, that marriage can block their career, fine, no problem. Now let's go with the what are the strategies. These are the problems we discussed. Okay, once again, just revise it quickly. The first one is overpopulation, another one is the early marriage, then health of a mother, then we have the deformities, low rate of maternal mortality rate called as MMR, and low rate of infant mortality rate called as IMR. Fine. Then we have the sexual transmitted disease and the carrier blocking. Fine, no problem. Now let's go with understanding the strategies. What are the strategies? Okay, what remedy we have to tackle with these all problems. So first we have is called family planning program, and that's a very good news. It's very, you can say, it is factful that India is among the all country. India is the one who initiated first this family planning program in 1961. Okay, under these programs, you can say small families are, you can say, educated to have. Basically, under this program, the family planning program, okay, families are educated to have the 2 child. Okay, hum do hamare do slogan and many more. And by this family planning programs, we check the population rate, we check the maternal mortality rate, infant mortality rate. Fine. And thereby we manage the population. Then we have the awareness about the reproduction. Okay, you know that all the audio visual media, printed, governmental and non-governmental agencies called as NGOs, they're doing their significant job regarding awareness of the reproduction. Fine. So that's another strategy. Then we have the sex education. Sex education is, you can say, previously it was, you can say, a kind of, you can say, education. Fine. But nowadays it's very less in our curriculum. But in this, you can say, class 12, this chapter is basically meant for giving you the education. As I said, you know that apart from the academic knowledge, these chapters also give you some your life saving, fine, knowledge. Understand? No problem. Then we have the knowledge of growth of reproductive organ in studies. We have to also educate. We are also already educating, okay, educated the people about the reproductive organ, okay, and the STDs, that's called the sexual transmitted disease. Okay, then we develop certain birth control device. Okay, and we also have the special care for the mother who is bearing a child. Okay, who is bearing a child. Fine. So under the birth control device, we have the many devices which by which we can control the birth. One of the example is your condoms. Okay, another example is like some this is a barrier method. Basically a condom is a barrier method. We will discuss that is called as the IODs. Okay, that's basically called as the birth control device. Okay, and under the birth control device we have the many devices. Some are, you can say, called as the barriers, like the condoms. Fine. Some are the chemical, you can say, compositions. Fine. Some are the IODs called as intrauterine device, and many more. We will have the detailed lecture over it also in our upcoming lectures. Okay. Then talking about the prevention of the sex abuse and sex related crimes. Okay, we see that now there are the law which is enforced, okay, to overcome the sexual, you can say, the abuse, okay, and also the sex related crimes that like the rapes. Fine. Then we have the research in reproductive health area. You know that there is one company in the Lucknow, okay, CDRI, called as Central Drug Research Institute, where the one in the whole world, the first, you can say, non-steroidal reproductive drug are developed called as the Saheli, okay, in the Lucknow, in our you can say institute. Okay, so that's a discovery. Then medical facilities, now we have, you can say, the advanced medical, you can say, team. We have now advanced medical equipments by which we can maintain the reproductive hygiene. Okay, we can perform the very keen, you can say, the procedures. Are you getting the points? So this is about the medical facility. Then we have the amniocentesis. Amniocentesis is basically a medical procedure in which there are, you can say, the laparoscopic, you can say, ultrasound probe are inserted into the female uterus. Okay, and thereby they extract some amniotic fluid. Okay, and in the amniotic fluid there are, you can say, the genetic components are present. Okay, so if you analyze it, you can easily understand about the genetic problems by which the baby is suffering. Okay, the baby which is inside the mother womb, okay, whatever genetic problems he or she is suffering, okay, that can you can say priorly detected by this amino synthesis process, just because of those amniotic fluid. Amniotic fluid is basically surround the baby who is inside the mother womb. Okay, it's provide basically one cushion, okay, a protective cushion. Fine. So if you take some of the amniotic fluid, and if you karyotype, you can easily not understand about the basically the genetic disorders. You can also understand about the baby's sex, okay, about the baby sex, that baby is male or female, okay, boy baby or girl baby. And just because this amino synthesis is developed for another purpose, it is for the fighting with the genetic disease, okay, early detection, so that the doctors can immediately cure, immediately start the interventions, okay. But this is misused, okay, this is start using alternatively for determining the sex of the baby, and that's why there is a massive destruction of the female child, okay, and that is called as the female feticides. So amino synthesis is it's illegal, okay, it's legally banned in India. Fine, no problem. So these are the strategies. Now coming to the amino synthesis, as we discussed, now see the picture. You are seeing that basically we insert a needle, we extract some of the amniotic fluid, okay, and this amniotic fluid is analyzed biochemically, a karyotype is performed, okay, and thereby we can understand the genetic diseases, like the NCERT write down some of the disease, written some of the disease called as the Down syndrome, okay, Klinefelter syndromes, okay, some of the hemophilic genetic hemophilias, okay. So these are the genetic disorders. So if you take the amniotic fluid, okay, and biochemical testing is done, then we can easily identify these you can say the diseases, the genetic diseases. Fine, no problem. So this is illegally banned, okay, it is illegally banned just because of the female feticide. So this is already asked in the NEET exam. These are the NCERT lines you should keep in your mind. Fine, no problem. Now this is the NCERT line, and it says that better awareness in the sex related matters, increased number of medical assisted devices or deliveries, or better postnatal care leading to the decreased maternal and infant mortality rate, increased number of couples with small families, better detection of and cure of STDs, and overall increased medical facilities for all sex related problem, okay. These all indicate improved reproductive health of society. Now these lines, what it means, it means that now we have the better you can say control over the sex related matters. Fine, we have the increased medical, you can say the delivery system, okay. We have the better postnatal care. See, prenatal care and postnatal care, these two words you have to understand. Prenatal care means when the mother is bearing the baby, okay, that time whatever care is provided, that is called as the prenatal care. And after the birth, okay, whatever care is provided to a mother, that is called as the postnatal care. So now we have the better this caring you can say the process. Fine, and that result, as I discussed, that now there is a less maternal mortality rate. Maternal mortality rate means a rate which determines, which shows that how much females die annually, okay, having the baby and die. So now just because of betterment, advancement in all these fields, we have the less maternal mortality rate as well as the less infant mortality rate, okay. And also we have now, just because of the family planning program in India, initiated in 1961. Remember the date, 1961, first country, India. The program name is family planning program. This is already asked in the NEET exam, so you have to mug up these lines. Fine. So in these you can say, just because of this family planning program, now we have the small couples, I mean small families, small couple families, okay, the less two दो हम दो हमारे दो we two our two. Fine. And we also have now the better detection of the STDs. Now we can, you can say, early detect the STDs. Fine. We have the techniques, okay, by which we can easily detect the sexual transmitted disease, okay, and overall increase in all the sex related fields. Now we have the better reproductive health of a society. Are you getting the points? No problem. So these are the NCERT lines, you should keep it. Sometimes what happened, NCERT directly you can say extract the line and put it into the questions, NTA, okay. So you have to better control over the NCERT lines, okay. First deal with the NCERT, then you can go to the advanced, no problem. And now we just discuss about the population stabilization and birth control. As we discussed that significant all-round development in the various field, okay, over the last century. Now we have the, you can say, better control. So if you take the previous data, then there is explosive growth, okay, explosive growth just because of the improved healthcare facilities and the living conditions. So in the 90s we have the world population. We are talking about the world population, and these data are in the NCERT. Okay, so you also have to understand this, remember this data. It's quite simple. 2 billion in 19th century, okay, then 6 billion in 2000. See the, you can say, the exponential growth. Then in the 2011 we have, in 2011 since report, Janganna report, we have the 7.2 billion population. This is the world data. Once again, 2 billion in 90s, 6 billion in 2000, and 7.2 billion in 2011. And now I should recommend you to comment down current population of 2024. Fine, no problem. Now coming to the India, the similar trend is observed in India too. Okay, similar trend is observed in India too. The population which is in you can say 1947, in our independence times, is the 350 billion. It's reached 1 billion. 350 million was in the independence time 1947. Okay, but in 2000 it's become the 1 billion. Okay, and in May 2011 it crosses 1.2 billion, but according to the 2021 population rate of India, it is 1.454 billion. So population wise we are billionaires. Are you getting the points? Fine. So this is the data which is present in NCERT, and you have to understand and see the exponential growth, how fast it was. Okay, how fast it is basically. Now, so what are the why this rate are happened? So as we discussed, there is a decline. These are the NCERT lines. A rapid decline in the death rate, okay, maternal mortality rate, okay, and infant mortality rate, and overall increase in all the reproductive is, okay. This is the probable reason. Okay, just because of better control over all these things, we have the increased population rate. Okay, and such an alarming growth can lead to absolute scarcity of food, shelter. These are the basic need, no, food, shelter, and clothes. Okay, and it inspired the significant progress made in those areas. Okay, no problem. Now coming to the population control measures. So what are the measures government has taken to overcome the population? Okay, so that we continued in our next lecture. So concluding to today's class, we understand about what is the reproductive health. Fine, what it is, its significance, it have the significance apart from the academic value. Okay, we discussed about the lecture outline. We discussed about basically the reproductive health, what reproductive health is. Then we discussed about the reproductive health problems and strategies. We also discussed about the amniocentesis, a vital process which is misused. Okay, and just because that, and there is a, you can say, legally banned, this amniocentesis is banned. Fine. We also discussed about why the population rate increases. We discussed about the you can say population growth trend in world as well as in India. Fine. And we also seen the reason why that much you can say the population is growing. Okay, and we also discussed that if that trend is, you can say, maintained or continued, then we have the basic scarcity. Okay, basic things scarcity like food, shelter, and clothing. Okay, and what are the measures government taken? Okay, we will discuss in our next class. So I hope you understood today's lectures. Go and read the NCERT lines, highlight the lines. Fine, and see the previous year's paper too. Best of luck. Bye. Have a nice day.